If you do get diagnosed with prostate cancer, what happens next? First, realize that you don't have to make a decision immediately on what to do. There's plenty of time to gather information, to find out as many facts as you can, and to ask a lot of good questions of your doctor. This disease is very controversial in terms of management because there haven't been many good studies comparing the different treatments. There are now 14 treatment options for men with localized early-stage prostate cancer. And one of them includes conservative therapy, where immediate treatment is not at all necessary. The fact is that many of the men who do get diagnosed today may never suffer from their disease even if they don't get treated. So your goal should be to find out as much as possible about all of the options available. And it includes asking the right questions. Now, ultimately, you're going to have to make some decision because all the treatments have both good things about them and things that are not good, things that may compromise your survival or quality of life. Essentially, this is a trade-off of good things versus bad things. And the kinds of questions you want to know are the following. You'd like to know for each of the treatment options, what are the odds that you're going to benefit? And what are the odds that you're going to get a side effect? Too many doctors may tell you the names of side effects, but they don't tell you the odds. And in some ways, it's like playing a game of blind blackjack, where you're dealt some cards and asked to make a decision or make a bet without being able to see the cards that you're holding. In other words, you have no chance to weigh the odds of winning and losing. And the treatments for prostate cancer are about the different trade-offs. Certain men may be better off with a conservative therapy, other men with surgery, others with some form of radiation, or one of the other options that are available. The facts are that we don't know for sure that any one treatment is clearly better than another. The only treatment that has been compared is a study was done in Sweden in which men had either a radical prostatectomy or they were treated only if the cancer spread to other parts of the body. And at the end of 12 years, the study found that there was an improvement in survival by less than 6% in the men who ended up with surgery. In other words, about 16 men had to get treated for one to live longer. So you may find that with your type of cancer, treatment immediately isn't necessary, and you might be willing to take a more conservative approach. The bottom line here is get as informed as you can, find out the facts, and ask your doctor specific questions. Now, when you do talk about the odds of getting a good result or the odds of getting side effects, an important question to ask is, whose side effects are you being quoted? Did the doctor actually measure his or her own side effects? Or were they read and reported to you from a publication by a noted famous expert in the United States or elsewhere? The key is that you want to know the odds of getting a good or bad result by the doctor who's going to treat you. And the more experienced they are, the better their results. So you may be interested in seeking out someone who specializes in the treatment of prostate cancer. And there are people who specialize in the surgical treatment, there are other people that specialize in the radiation treatments, and there are still people who do other options that are available. The bottom line, again, get informed, participate in this decision, and realize that each of the options does have trade-offs, and you have to decide which ones you're willing to accept.